Hi, this is board-certified nurse practitioner Joe Flores. I'm also an attorney. We've made a great documentary that is interviewing nurse practitioners. Many of you all out there don't know what nurse practitioners do and what the difference is between a nurse and a nurse practitioner. We're going to underline those differences. Nurse practitioners have advanced skills. They can prescribe, diagnose, and treat many illnesses that physicians can. In Texas, we work in collaboration with physicians in order to provide quality care. As we've seen, there have been devastating cuts over the last decade here in Texas on Medicare, Medicaid, and providing services to the elderly and the most vulnerable in our society. We interviewed nurse practitioners who educated people out there during our interview and on the road about what nurse practitioners do. We've also provided commentary on what you can do to get involved. We'd like for you to tune in right now. It's very important because healthcare affects all of us, and the delivery of that healthcare by nurse practitioners is going to be the next wave that's coming in to provide and meet that gap of care as the society and our population ages. So tune in with us and welcome to our documentary.
Hi, I'm Christy Day, and I'm a nurse practitioner, and I live in Corpus Christi, Texas.
I'm a nurse practitioner. I work in family practice at a clinic in Kingsville, Texas, and I also work in occupational health at a big manufacturing plant we have between Bishop and Kingsville. It's a Celanese plant, and I take care of all the human equipment out there is what I do.
Yes.
Elizabeth Liao.
And how long have you been a family nurse practitioner?
For 4 years already.
Susie Enriquez.
And what do you do, Susie?
I'm a nurse practitioner and I work for Christus Spawn Hospital, Alice.
I teach full-time at the university. I teach nurse practitioner students, and I work as a nurse practitioner in a nursing home.
Well, we're basically physician extenders. We work in collaboration with a physician who is our supervising physician, and we see patients alongside with them. They don't
and that
have
means treating, prescribing,
ordering assessing, drugs, ordering prescription medications. Pretty much everything a physician can do, of course, with the exception of ordering some narcotics and, of course, some treatments. Again, our practice in Texas is regulated primarily through a supervising physician, not necessarily on site, but for example, in the ER setting, we do have a physician on site. If we're sometimes we're out doing the home health as well as the hospice recertifications.
It's like a house call.
Exactly, exactly. And really, I feel that's the wave of the future.
Well, an advanced practice nurse is a registered nurse and also a nurse practitioner or a clinical nurse specialist. We also have nurse midwives, and we also have nurse anesthetists. And what happens is we collaborate with a physician and we go out into areas where there aren't any physicians, and then we work with patients and we can manage acute and chronic illness, and we can prescribe medications, and we can manage about 90% of all of primary care.
Well, the nurse practitioner is basically an advanced practice degree. We have additional education in assessment and disease assessment as far as assessing the patient. Right. We have advanced education in pharmacology, so we can prescribe and administer the medications. We can order diagnostic exams. One of the main things is, of course, the advanced practice nurse has the advanced education past the RN degree. Typically, it's a master's level degree, although that's going to change by the year 2015, and they're going to require a doctorate as the terminal degree for nurse practitioners.
Well, an RN is a registered nurse, and a nurse practitioner is also a registered nurse, but We have additional education and training. We're advanced practice. We have a master's degree. We've been through hundreds of hours of clinical work in community clinics in our own areas that we live in, and we are actually able to prescribe medication. We're able to go in and do health assessment, make a diagnosis, and then come up with the treatment plan and prescribe medication for our patients.
And you know, I like to say that doctors need doctors. Nurse practitioners need doctors. Where we work as a team. Physicians will refer to one another, and we refer to doctors, and we appreciate that collaboration.
Well, we can go to them. We're the, again, physician extenders that go to them in their home, in their home setting, and the primary goal as far as home care is concerned and home assessments is actually keeping the patient out of the hospital.
Isn't it true studies show that if you do a visit at home, it will prevent ER admissions?
Yes, that is the goal. And with all of the cuts in healthcare heading our way, you know, that's really what we're trying to, where we fit in. They can utilize us in the home setting, again, reaching out to the people who otherwise cannot make it to the physician's office for whatever reason. Either it's lack of transportation, or they physically cannot drive anymore, or don't have the means financially to get themselves to the physician.
Yeah, I think that would help so many people. They have difficulty with transportation in our rural areas, and house calls would be an answer. They don't have family members that can bring them in often, and that would really help to service the rural community here in South Texas.
Let's discuss the nurse practitioner career, average salary, and education options. First, let's answer the question, what exactly is a nurse practitioner? A nurse practitioner diagnoses and treats illnesses independently or as a part of a team. They also interpret lab work and x-rays and may prescribe medication. So how much does a nurse practitioner earn? According to payscale.com, the average total pay for a nurse practitioner is between $69,000 and $90,000. Specific salaries depend on location, specialty, and experience. Finally, how do you become a nurse practitioner? A nurse practitioner is a registered nurse with a specialized graduate education. Employers reviewing a candidate with an online degree will want to ensure the program is accredited. You can browse such accredited online programs at www.onlinenursepractitionerprograms.com.
Well, there's a wealth of studies, lots and lots of studies, and they all demonstrate that nurse practitioners provide safe care and that our customers and our patients are satisfied with our care. So because we provide safe care and we provide quality care, that reduces the cost of care. So that's what I see.
A lot of your common people that come in with infections, little injuries that happen. We suture up a lot of lacerations. I take care of lots of abscesses. I treat people by giving them antibiotics. Diabetics come into the clinic and we make sure that they're doing what they need to do to manage their blood sugar. Hypertensives come in and we take care of their blood pressure by getting it down with medications, diet, lots of teaching, trying to get their diet and exercise regime back up so that they can be on the right track with their health. We want healthy outcomes for our patients. So we treat children, geriatrics, older people, working people, just about everybody in the community.
Currently, my project is working in Alice, in the rural community, where childhood obesity is an epidemic. Not only has it reached epidemic proportions nationally, but certain populations are affected more so than others. For example, the Hispanic population in rural communities, childhood obesity and obesity in general is a problem. So there's definitely a need to reach out to those communities as well.
I see a variety of people, very chronically ill, diabetes, hypertension, you name it, it's there out in the rurals. A lot of patients don't have anywhere to go, or they don't have a means to get to their physicians. Our clinic, luckily, is walk-in, so if a patient is sick, they just come to the clinic because you don't need an appointment. And we get people from Alice, or get them from, I think my farthest patient is from Victoria.
Well, you know, I work in a rural clinic, and there are folks from about a 70-mile radius that come in to see us in our local clinic in Kingsville. And many of these people can't be seen during business hours. They work. You know, our clinic's open till 11 o'clock at night. There's really not anybody to see them unless they would come into Corpus Christi for, that would be a 90, 100-mile radius or travel for them. You know, they just don't have a place to go that's nearby. So it's helpful to have, you know, to have somebody there in a clinic that can see them and meet their health needs on the weekends and after hours. So there's a tremendous need, We have a lot of people come into the clinic that we can't even see. We have to turn them away.
We now have a pharmacy in our in Freer, and they've been there for a year, so it's been very helpful, because before that, people would have to wait like the next day to get their medicines from Alice, but now we have a local pharmacy. You know, you can treat them right away, you can avoid the pneumonias, and of course I do use our physicians in Alice mostly to resource. We have a cardiac, we send them to the cardiologists, surgeons, any kind of lab testing or CAT scans, you know, they all go to Alice, so, you know, we stay close to the communities.
Well, it allows physicians for those clinics to provide care for more patients. It increases the access to care for patients, so that when they go in, they don't have to wait 2 weeks for an appointment. They can get an appointment sooner, and it just expands the fold of the number of Medicaid patients that can be cared for.
It's time to do a bit of simple math. There are about 35 million of us here in Canada. Most of us are relatively healthy most of the time. And when we're not, a huge percentage of the things that are wrong with us are important to us, but they're not life-threatening. Fevers and flu, and cuts and bruises and ear infections, and even chronic illnesses like diabetes. Sometimes we need to talk about or change the medicine we're taking. Sometimes we just need to talk to a healthcare provider and be reassured. When you think about 35 million people and their illnesses and aches and pains and questions and worries, it's pretty clear how it puts enormous strain on our healthcare system. And when you factor in that there are almost 5 million of us with no primary healthcare provider at all, it's pretty easy to see why your local hospital emergency department is getting really crowded. Well, here's another number worth looking at. There are about 3,000 nurse practitioners in Canada. And the point of this little story is that they could really be an answer to the problems we're facing. Nurse practitioners are, well, nurses. And that means they have a very special way of caring for people. With advanced education, training, and experience, nurse practitioners can manage chronic illnesses like diabetes, order diagnostic tests, write prescriptions, and a whole lot more. So, if we can put more nurse practitioners in doctors' offices, walk-in clinics, emergency departments, and other settings, if we gave nurse practitioners a chance to make a difference, imagine what they could do. For starters, nurse practitioners could help practically every one of us folks who are waiting for someone to provide health care. and the care we'd get would be excellent. And the addition of more nurse practitioners to the Canadian healthcare equation would give some other amazing benefits too. Shorter wait times, 30 million of us getting more access to the care we need, millions more of us finally finding someone to look after us, and 35,000 overworked Canadian family doctors would see a huge amount of pressure taken off them, allowing them to focus on acute and complex cases. See how the numbers add up? Do you see how adding more nurse practitioners into our equation is going to look even smarter? Pretty simple math, isn't it? Talk to your elected representatives. Go to npnow.ca to find out how to do it. Nurse practitioners. It's about time.